Hey everyone, it is Kevin Henry, the co-founder of Ignite DA. Hope you're doing well, and honored as always to bring in my co-founder of Ignite DA and the founder of Ignite DDS, Dr. David Rice. Hey Dave, how are you, man?
I'm great, Kev. How's it going in sunny Colorado, or is it snowing today? Who knows?
I think we're past the snow, I think, but we'll see. I should knock on some wood real quick.
You should knock on some wood. But listen, I'm super pumped for all of you who don't know to meet our friend Paula Harris. Paula, how are you?
I am great. Thank you so much. It's so good to be with you.
Yeah, it's good to be with you too. So Paul and I have known each other for too many years to say out loud because clearly we're both in our late 20s doing dentistry.
Of course.
So
Okay.
yeah, but it's great to have you. And I'm excited for the three of us today to chat all about
Mm.
the whole dentist. I'm gonna say we say like versus hygiene versus patient and what's going on in the world, and I think we just call it out and address it. But Paul, I know you've got some great thoughts on the dynamic that's happening as we sort of re-enter. Love to hear you share some things.
Yeah, thank you. Yes, it's been quite an adventure in the coaching arena with a lot of people have had time on their hands. I think I've worked harder in the last 2 months than I've ever worked in my whole life. But there's 7 areas to consider as I really try to capsulate everything. There's the hygienist view, there's the media view that has kind of fueled the flame, if you will. Then you've got the view from the dentist side, you've got the patient's view, you've got the PPE situation, and you've got the team harmony, the assistants and the admin team and associates who are involved in this too. And then you have what are our solutions? So I don't like to just talk about problems. I like to talk about solutions because that's really what we need to spend more time on, right? So
Totally agree.
yeah. So would you like me to just kind of share some of what I'm hearing from the hygienist?
Yeah, let's talk about what the hygienists are thinking out there. What's
Sure.
going on with them?
Okay. I'm hearing a wide variety. I don't know about what you guys are. Some teams, the hygienists are just fine. Everybody's back to work, no problems. I've kind of put together a number of between probably 2 out of 10 team members are having issues on a team. Not all just hygienists, but that's kind of an average of what I'm seeing. So the hygienists are telling me, I don't think my doctor's taking this seriously. We're concerned that it's all about the money and it's about getting back to work before we're really protected. And there's a lot of information out there about the CDC and the OSHA and ADA. Everybody's got to put their 2 cents in from what I'm hearing. And they're concerned. Some of them are genuinely concerned, and some of them are being taught to be concerned. Whatever that means. So, there's a theory that I grabbed onto a few years ago out of a book called The Shack. Does anybody remember that in the movie?
Oh yeah.
Yeah, yeah.
And he didn't say this in the movie, but in the book it said when we focus on the rules and we focus on our rights, we break relationship. Now, I'm not saying we don't need to focus on the rules and that we don't need to focus on rights. Those are important. But is that sacrificing our relationship? And that's what I've been seeing, is the relationship has been sacrificed. So we've also got the media mixing in here of the hygienist job is the most dangerous job in the world. Have y'all seen that? The pictures and the...
Yeah, Kevin, you probably hear a lot of it too, right?
Yeah,
Media.
and I've got to say, I, as a longtime member of the media, I'm just gonna to take that hat off for just a second here. You know, I think that we're reading the hygienist, but it's also the assistant. It's also the dentist. They're all listed up there so high, and I
yeah.
think we've got to realize that if you take the right precautions and you do what you're supposed to do, there's always danger involved. God, I still remember if saliva were red. That still haunts me at night sometimes. I'm just telling you. So, I think we've had this for so long.
Yes, we have.
And obviously, we're all up here with it, but still,
Great
so,
point.
here you go.
The risk has always been there. And my seasoned clients who've been in dentistry 30, 40 years, many of them, Dr. Rice, have said, if this is such a huge concern over all these years, where are all the dead bodies? Where are the dead dentists and the sick the team member? We've been living through these new diseases that come down the pike, and we are protected. I mean, I know there's some new things, and we can step up our game. So the concern I'm having is when I see team members creating list of demands. I got an email one day that's 5 pages long of demands, and they're passing this around to their team members and trying to get their team members on board and up behind the doctor's back. And that I don't think that's going to help really solve our concerns. And then I'm seeing some hygiene organizations. I mean, I have backup on this stuff, but here's one of instructions on how to report your dentist. Make sure you take notes, document all violations, make notes, make sure you have your refuse to work without proper PPE ready, offer to do something else, then blow the whistle. So this is out there for the team members to see, instructions on how to report your dentist. I mean, is that going to solve that just bothers me. Does that bother you guys?
Yeah, that's a problem. Kev, are you hearing that from any of the assistant groups as well?
Yeah. And Dave, you and I have talked a lot about hazard pay. That's such a word right now about that. And you're right. Let's make sure that there are some assistants out there they're obviously nervous, they're obviously scared, they're obviously what comes next, but there are those out there that are also doing, Paula, what you were just saying about, well, here's what we do if we don't get our way. And there's just if you're really pushing team, there's no room for that mentality at all.
No I in team.
Really.
Yeah.
No.
So, and I know that this second round that passed the House last week that hasn't passed the Senate yet has some hazard pay built in there. So it's kind of like they're trying to go for that. But like we said, these risks have always been there. And so, I mean, then from the dentist side of things, I know that some of the dentists have been flippant about this. So I've heard them say it to me, like, I'm not worried about this. And I totally get the team being concerned if they see their dentist acting that way. I would be concerned as well. Like, I'm not buying any of that stuff, and a lot of this isn't mandated. And a lot of dentists have said, well, I'm not doing anything until it's mandated. And so we're getting some of that. And I think this goes back to dealing with objections with our patients. It's the same principle. We have to validate. And I know the dentists are frustrated. They've been focusing on these stupid PPP loans, and all the rules keep changing, and the EIDLs, and they're trying to figure out how to open the practice. And some of the team members have this has happened in a few states where there's a date to reopen, and then team members and organizations representing team members have gone to the governors and the health department and said, no, we don't want to open. And the night before, the rug gets pulled out. I mean, this is a fact.
That sounds familiar.
Like,
my New York State being one of them.
Yes, exactly.
Yeah, absolutely.
I could name some other states, but I won't. But
yeah, and I agree with you. I think what you said earlier really struck me was when we start putting other things before the relationship, it breaks down. So if everybody's kind of drawing their line in the sand and they're anticipating pushback, then we're everybody's on edge. So how do we get off the edge?
Well, I think we have to get some perspective of our patients want to come back. Every team I talk to, the majority of the patients are dying to come back. And we've got oral systemic issues. Are we looking far enough into this to really patient care? Some of the doctors don't feel like the team cares about the patients anymore. And some of them feel like it's only about unemployment. So I want to stay on unemployment. Some of them feel like they're just trying to claim FMLA. And there's just a loss of trust. And I think that's going to take a while to repair. And I think we have to think about what our governing bodies are. The ADA is not a governing body for us. The ADHA is not a governing body. All these other organizations, they don't tell us, they don't rule us.
Right.
So we have to keep that in perspective. So I think another thing I'm hearing is these demands for PPE, and I mean every single team I talked to in the last 10 days, and I've been on site, they're not wearing it. Some of them are wearing it, some of them are not, because they're too hot.
Right.
I can't breathe. I'm hearing this from every team. I talked to a group of hygienists today. They said, we're done with that N95 thing. And so the dentists are like, wait, you, we couldn't open, and that's not mandated now. I mean, the CDC's changed the surface contaminant length of time. They've changed the aerosol study. MUSC is doing a great aerosol study right now. So a lot of this is becoming downgraded a little bit. The CDC put out a recommendation, I think it was May the 19th, that level 3 and face shield is okay. OSHA's saying if you made your best effort. And so I think we kind of have to come to the middle with some of this. Is this kind of what you're thinking? I mean,
yeah, I think, it's interesting. One of the best perspectives I heard as far as PPE goes was good, better, best. And when you have access to the best and you have plenty of supply of the best, use the best. And when we don't, then we have to know that the fit tested N95 is probably not a realistic plan for a lot of dental practices, at least in the moment. It may come to that. Kev, what are you hearing out there?
Yeah, and I think you're exactly right. I think if you wait for everything to be perfect, till the right time, we're going to be waiting a while, unfortunately. So I think that I think there has to be compromise on both sides, just like any relationship, marriage, friendship, whatever it is. There's got to be some kind of compromise here between the dentist and I'm going to say not just the hygienist, but the team.
Yes, for sure.
Absolutely.
For sure.
Absolutely, I agree with you. It's come to the point, I've had 5 dentists tell me in the last 2 weeks, I'm ready to eliminate my hygiene department. And one has petitioned, I know of 2 states, right off the top of my head, that have been petitioned to allow the expanded function dental assistants to do hygiene. The ADHA stepped in and stopped that in one state. They flew out to that state to stop that. So I have that in front of me right here. Actually, you have that in your hands. So, I can understand the lines in the sand. I think we've got it both sides. Please hear me. I'm not taking sides here. I'm just sharing what I'm hearing and how can we pull together. So what are some solutions? I think, first of all, like I said, the dentists have to validate their team's concern and not be flippant. That will go far.
For sure.
And that is leadership, not management. A lot of doctors are very comfortable in the management role, but not in a leadership role. So do I need to make that distinction? Is that pretty clear, you think, to your...
I think that's one of those things we know. It's just a question of whether we do something about it. As the dentist, or quite honestly, to Kevin's point, is anyone on the team. Are you a team member, or are you a leader on a team? And then ultimately, the person who owns a practice really needs to step up and realize that nobody really likes to be managed.
No, the management is about the task, and that needs to be done. And we've really been in task mode with researching the PPE, the loans, trying to figure out what our states are doing, all those type things. That getting everybody back to work, the rehire letters, the all this stuff that we have to deal with on the task side. But the leadership side is, are you caring about your people? And I know for a fact, my second solution is appreciation. I had a team who was passing around this list of demands, and she told the office manager, well, I never feel acknowledged around here. And
pretty common.
It is. I mean, it's the number one thing that keeps a team together is appreciation. And the doctors are like, appreciation? They've got a job. I've saved their job. How can they? So I think we have to realize and step out of our comfort zone a little bit and acknowledge and appreciate people on our team. I mean, that's always been the case, but even more so now.
Absolutely.
Yeah, it's true. And Paul, I will say there's a lot of folks that you're right. They think, well, I kept your job, I saved your job, I paid you while you were out, and that's good enough. But those are the things that need to be communicated. It can't just be an assumed thing. And I think that's what I hear so much on the team side is that everybody's assuming something about the other person and they're not actually verbalizing it. That's where some of the problems are issued.
That's where they've been focusing on rights and rules and not relationship. And there's been a ton of rules thrown at us right now. It's just very difficult to keep up. So I totally understand. But I think we have to make an extra effort. One of the things I recommended during the shutdown was please have Zoom calls or video calls with your team twice a week. I've had some of them coming to me like, is the doctor okay? Should I look for another job? I haven't heard anything from her. Are they going to be able to pay me when we come back? And some of them, I tell the doctors, and you talk to your team, they call them up. The team just breaks down in tears like, you still remember me, So we have to stay in communication. I think talking to each other, the third thing is super important. We have to keep the communication open. And right now, I'm seeing people trying to cram production back in and get the schedule back up, and they're eliminating some meeting time. It's not a good idea. I think keeping our meeting times is more important than ever. And it may feel like you can't afford to do that because of production, but I think you can afford not to if you're going to keep your team on board. And then the fourth solution, I think, is you may need a mediator. You may need a third party who can talk to you and this team member or talk to you and this department to help you repair some of this damage. And I've tried to offer during the shutdown. I did a pep rally. I did a talk on grief. I did a money talk on budgeting and finance. I mean, so some of these soft skills and some of these people skills are really necessary right now. And learning how to have a conversation in leadership mode is really important. So that's kind of what I'm seeing out there.
Yeah, I think we can all agree tensions have gotten a little high. I think as we come back to practice and people get back in the swing of things and we see each other again, that a lot of that's going to go away. A lot of it just is try as we may to do this virtually, which, we've done with our practice. Kev, I know we've talked to a lot of practices doing it too, but those who haven't are going to have a harder time. Those who have still, I think just being in the same place together is going to be helpful. Getting busy again. Seeing that it's not all falling apart. Patients, to your point, Paula, they do want to come back. They're anxious to be back. It's going to solve a lot of the problems.
It will.
Yeah. We've had a little too much time on our hands, and I'm never a fan of too much time, whether I'm at work, we all know it, right? That's when it falls apart, the practice too. When I'm the only one working really hard and everyone seems to be joking and laughing, but we've all had those moments where somebody else has 30 extra seconds than we do, and we feel like we're the only one going through it, and it's just never true.
That's right.
Yeah.
I know everyone is working really hard, and we want to create a safe environment for our patients. And I'll tell you, the patients, like I said earlier, are excited to come back. I mean, they already know they're safe in your practice because you think about it. The medical doctors, they haven't been wearing masks and gloves when you go in for an exam. And we've been doing this for a long time. So patients are really feeling safe. So that's good news to me.
That's great news. Kev, what are you thinking?
I'm thinking you're exactly right. I think that if we're getting this message out that it's safe, that's one thing. But Dave, like you and I have talked about in the past, if there's that little tension running under the surface, that can certainly be picked up by the patient who comes in, and that's just going to ramp things up. So if there's something going on in your practice, boy, now's the time to pop that bubble and make sure it doesn't keep growing.
93%, 94% nonverbal communication. And we also want to avoid team members putting on their Facebook pages, I'm really nervous about going back to work.
Yeah.
Things like that. That doesn't help.
Yeah, that's a great reminder. You know what? I think maybe to wrap it all up, I really like what you said, Paul. Our patients trust us and they know they're in great hands. So maybe when it gets difficult for any one of us on a dental team, we can just kind of take a step back, take a deep breath, listen to our patients who come to see us for 2 years, 5 years, 20 years. And when they share how much they trust us and how grateful they are that we're all back. So just realize that we're amongst the same friends and people that we've known, liked, and trusted for a long, long time. And a lot of this gets better right away. So
you're so right.
Gang, you guys are awesome.
Thank you.
Thanks for the chit chat. I hope you all have a great day. Anyone has any questions, drop them here and we will circle back with you ASAP. And until next time, Kev, any final thoughts?
I say together we rise. How about you, my friend?
I think you got it. Thanks, everybody. Take care, and we'll see you soon.
Thank you so much. Bye.